We've been asked to review how we were able to train Natalie, someone with no dental experience at all, to operate at such a high level in less than 30 days of actually working with patients. So this is kind of a review of our TDO lecture, but basically it's pretty simple. You develop keystone habits, you realize early small wins, you develop skills incrementally and sequentially, and this is a very professional way to actually train someone. So we'll just review this very, very quickly here. This is Natalie. She has less than 30 days of actually working on patients. She has no experience whatsoever in dentistry. So we started with developing her keystone habits. We realized early small wins. We repeated these things thousands of times, and we GoPro'd ourselves and had her practice as the doctor. The keystone habits are an essential part of professional training, and realizing early small wins likewise are very important in this process. And utilizing these techniques will enable you to train almost everyone. One of the things that's really helped is having Natalie practice as the doctor and repeat all of these keystone skills thousands of times before she was ever allowed to work on a patient. Here she is as the doctor, working with joy, understanding what it's like that the doctor actually feels. It also helped her understand the procedures because she had no dental background whatsoever. So this is an essential part of the training, and it's one of the reasons we were able to train her so rapidly. Here she is with one of the early patients assisting Dr. Robers, and you take a thing like anesthesia where there's considerable risk involved, and here she is managing the syringe pass just as well as someone who's been doing it for many, many years. And she's completely at rest, muscularly at rest, and completely relaxed and confident in what she's doing. So here she is loosening the cap. She's practiced this thousands of times before ever doing it on a live patient. There you can see this is where the accidents can happen, and we've essentially eliminated the possibility of accidents here because Jess is not moving her hand at all, and Natalie does all of the motions and understands how to manage the capping of the syringe. So this is a typical example of a very high skilled technique that was mastered very, very quickly by these techniques that we've outlined over and over again.